Hi everybody, my name is Danielle Mackle and I am a lecturer in social work at Queen's University. So my background and research experience really focuses in on LGBTQ plus people and their families. But today I'm really delighted and excited to welcome my colleague Professor Gary Mallon from the Silberman School of Social Work at Hunter College in New York University in New York. So Professor Mallon is going to take us through a really insightful and exciting presentation this afternoon, and then I will join Professor Mallon um, later on for the question and answer session in case there's anything specific to Northern Ireland that I can input into. So just to give Professor Mallon a brief introduction, he has been a child welfare practitioner, advocate, educator and researcher for 49 years. He was the first child welfare professional in the US to research, write about, and develop programs for LGBTQ youth in child welfare settings. And he has also written extensively about LGBTQ foster care and adoptive parenting. So I've heard Professor Mallon speak quite a bit, and I'm sure you'll really enjoy his input this afternoon. So, Gary, without further ado, I will hand over to you and just let me know when you'd like me to move on in terms of moving the slides.
Great. Thank you so much, Danielle, and thank you, Allison, and thank you, the Northern Ireland Social Care Council. I appreciate the opportunity to come and meet you all. I'm here in Belfast myself. I've been working at Queen's and doing some work there, which has been very nice. And I am then going to go down to Dublin next week and work at UCD. I am, my family is from Ireland. They're all from Donegal. And my father's family was from Armagh. So if you know that Mallon name, there's a lot of Mallons in Armagh. Um, I'm always delighted when I have an opportunity to come to Ireland to talk to folks about work that I feel passionate about. As Danielle said, I've been in this work for 49 years. In January, it'll be 49 years. I've worked in the child welfare setting for my whole life. I'm a professor at the Hunter College School of Social Work in New York, where I've been for 33 of those years. And I've been a foster parent myself. I've been an adoptive parent, and I've tried to live the talk I talk in the sense of caring for children, youth, and families for my whole professional career and for most of my personal life as well. So, and I just want to say a couple of things before we get started is, when somebody comes from the outside and they talk to you, sometimes the assumption is, oh yeah, what they're telling me is because they have it all figured out and they're trying to help us figure it out. I'm not 100% sure that we have it all figured out. I think I'm here to share my experience. I'm here to also kind of tell you what I think is really useful in terms of working with LGBTQ plus young people. In the US, believe me, we've had lots of problems lately around some of these issues. And, I always acknowledge that. It's not like we have it all figured out by any means. But I have worked in this field with gay, lesbian, bisexual, transgender, and questioning young people and their families for the majority of my career. So I guess for the most part, I share not just my research, but my own kind of practice wisdom around working with families. And I've always loved what I've done. So I think my passion comes through in kind of talking about the things that I think we need to talk about. So Danielle's going to help me move the slides. So we'll get to what we're going to talk about. Um, there's a lot of ways in which people who are listening on this webinar and in other ways that can really help support LGBTQ children, young people and their families. And I always say that children, young people and their families, because young people and children do not live alone for the most part. They live with their families. So when we're talking about LGBTQ youth, we also really need to talk about LGBTQ youth in the context of their family, because families have lots of issues around these issues. And I think that it's really important that as social work professionals, our job is to not just help the young person, but also to help the family. I'm a big believer in the things that I'm saying today are not so difficult for people to do that. And I believe that any social worker in every social service agency really can and should think about how they can do these things. When I first started talking about this back in like the early 90s, people were kind of shocked that you would even introduce the concept of talking about gay and lesbian and bisexual and transgender young people. I mean, I had people telling me we don't have any of those kind of kids. We don't do that work. And if you go to the next slide, Danielle, the reality is that everybody who works with young people works with young people who might be LGBTQ plus. Whether they've disclosed their orientation to you or not, or their gender expression or not, most of us have worked with these young people. What I say is that when young people sense that it's not possible for them to be able to be themselves, they go underground. And they also become invisible to people. I think when they're invisible to people, when people are not trained to, oops, hold on a minute. My computer did something weird there. When they're not, when professionals are not really trained to work effectively with LGBTQ young people, sometimes they'll say, well, we don't have any of those kids because they've never told me that they are. But the reality is that all of us have worked in any setting that you're working in. If you work with young people, whether it's a school or a residential program or a hospital or a mental health clinic or whatever, whenever young people are involved, you undoubtedly have young people who are LGBTQ in that population. Again, whether they're out to you or not is another story. And I'll talk a little bit about, I think, how can we talk about making it more comfortable for young people to be out and to be able to access the services that they need. So I broke this into kind of three areas when we're going to talk today. I really wanted to think about what do LGBTQ young people need to know, we need from social work professionals. So if you're a social worker or a social care manager, what do young people need from you? That's the first level that we're going to talk about. Secondly, because I always think we can keep on that slide, is secondly, is what do agencies and policymakers need to be competent in practicing with LGBTQ children, youth, and families? Because again, many of you work in agencies, you work in organizations, you might work in schools or hospitals or mental health clinics, and those entities also need to be able to let young people know that they're competent in working with them. And there's some subtle things that people can do, nothing dramatic, but there are things that people can do that really show that their organization is open to all young people and families. And then the last thing is, what can you personally do? Right? Because we all live ourselves in the context of our own families and our own communities. And, I know, in the United States, Thanksgiving is coming up in a couple of weeks. And, whenever I go to my own family at Thanksgiving, they always are quizzing me about what do social workers do? What do social workers think about this issue? So I know that we all are dealing with those kinds of things as well. And we also have, even though we're professionals, we also have personal feelings. And I think that and looking at all of these three levels, I hope we can cover a bit of ground. I'm trying for us to maybe talk for about an hour and then stop before, and give you all a half an hour so you can ask questions or clarifications. And please feel free to send those in the chat as I'm talking. If something comes up and you'd like us to talk about that or answer a question towards the end, the last half hour, happy to do that. And please don't in any way feel like you're going to ask something that is too embarrassing or that you should know and it's embarrassing to ask. It's okay. I think that one of the things about doing this kind of work is you have to make it comfortable enough to talk about these issues because there's a lot of discomfort that people have in talking about sexuality of all types, but particularly talking about LGBTQ sexuality. So, and people are afraid of using the wrong word. They're afraid of saying the wrong thing. They're afraid of being offensive. Don't feel afraid. Ask whatever you want, and if I can answer it, of course I will. It's probably nothing I haven't heard before, and just feel comfortable enough to be able to send a chat and ask that. So the next slide is our first question about our first kind of level of what do social workers need to do, and I looked at your website in the Northern Ireland Social Care Council, and they had this concept of fit to practice. So this idea of what do kids need from social workers? They need professionals who are fit to practice. They need people who are adhering to the standards of conduct and practice that is about attitudes, behaviors, competence, rather than using your own personal or religious values to guide you in practice. You can use your own personal and religious values personally, but as a social work practitioner, as a professional, we need to use the standard of conduct to guide us in practice. So I think that's a different level of, um, I don't know what to do, so I'm just going to do with, people used to say to me, what my mother told me. And I would always say, is your mother an expert in gay and lesbian issues? Probably not. I know my mother wasn't. But I think that the issue is, what does the standard of conduct for the profession say we should do with respect to ethics and values and treating people with dignity and working with vulnerable populations, rather than going back to kind of, oh, well, this makes me uncomfortable and I'm not going to talk about it, or kids shouldn't talk about this because if you talk about being gay, then they're going to want to be gay. Completely untrue. But I think a lot of times when we're not guided by professional practice, we kind of default to what we think we might have heard, right? Sometimes those are myths and stereotypes, and we're not sure if they're true or not, right? So I would always say, go back to what we do as a professional. And the reality is, and as I was putting this together, this is not rocket science. I mean, a lot of it is what you do with all clients, right? If a client comes to you and talks about something that is challenging or difficult or something you haven't dealt with before, we don't freak out and default to a personal opinion. We say, okay, what does the profession and what has my training taught me about dealing with people who are sharing sensitive information with me? So I think that's the first place I go is, if you're really going to be fit to practice, then we need to really uphold the standards of conduct and really ask people to think in that way. So Danielle, if you can go to the next slide. I always say this one is social workers need to be people who have done their homework. It's called social work because we're supposed to do work behind that, right? And a lot of times our own fund of knowledge is not very well developed, and then we expect that the young person's going to educate us about who they are. That's not always terrible. I think it's always okay to say to a young person, gee, tell me a little bit more about what that means to you, right? If a kid says to you, I think I might be a lesbian, or I think I might like girls like that, you might say, hey, can you tell me a little bit more about what that means for you? But it's not up to the client to educate us. It's really up to us to do our own research, to know about the resources to exist. And I always say, do we know people who I call cultural guides, right? Do you know a lesbian, gay, or bi or trans person from your community, from your neighborhood, maybe from your family, who you can ask some questions to? Not that they represent all LGBTQ people, but it's really nice sometimes to have somebody that you can call up and say, hey, is this true? I remember many years ago, although it's kind of an outmoded cue, but people used to call me and say, Gary, I got this kid here and he pierced his right ear, and I'm not sure if that's the gay ear. Can you tell me if that's the gay ear? And I would say, that's ridiculous. If you pierce your left ear or your gay ear, they're both gay ears. It doesn't matter which one you pierce. But people really wanted to know that. They wanted to know what the cue was, right? And a lot of times what we do is we try to identify the cue in the young person rather than sending out the message that we're an okay person to talk to about this. That's really what kids are looking for, because young people will look at us and say, are you safe enough for me to talk to about this issue? Because I know some of you, and I'm no judgment in any of it, but you on this webinar, but kids will say some of you are not safe to talk about, and some of you might be very judgmental towards me if I talk about this, and some of you, worst of all, might stop talking to me. And with families, maybe my family will even throw me out of the home if I talk about this. So kids are constantly looking for what's safe. Who is a worker that I can actually talk to? So I always say to people, one of the things you need to be able to do is to say to young people that it's okay for you to talk about whatever it is that you need to talk about with me. And I throw out some things like, it's okay to talk about maybe problems you're having in school, or it might be okay to talk about problems in your family, or it might be, challenges that you have with regard to sexuality. It's okay to talk about, issues about gay identity, or about being a person of color in a community where there are not a lot of people of color. I throw out some samples because I think that sometimes kids hear that and say, oh, okay, well, they said gay, and maybe not today, but maybe 3 weeks from now, maybe a month from now, maybe a year from now, I'll talk to them about that. So I think doing your homework and knowing that about young people is a really, really critical piece of this. It's not about identifying the cue in the kid. It's about the kid looking for cues in you that you're safe to talk to about this topic. Um, And I know that sounds kind of like, oh, well, I wish that he would tell me what I should look for. And there are some things that you can look for, especially with trans kids, and we'll talk about that maybe. But I think with respect to the young people, it's really about you sending out the cue that you're okay to talk to about this, that you're not going to freak out, that you're a professional, you've done your homework, you know. And if you don't know, it's okay to say, you know what? I don't know what it means to be non-binary. I don't know what sexual fluidity is, okay? And these are concepts that young people are beginning to use, right? Where non-binary is a concept of young people who don't identify particularly as male or female, gay or straight. They kind of will say, hey, I'm attracted to people, not parts, you know, and these are kind of emerging themes. We're not going to get into them in too much detail, but I think that sometimes young people will say things and it's like, I don't know what that means. And it's okay to say, gee, can you talk to me a little bit more about that? But it's also incumbent upon us to then go home or go to our office and do our own homework. Okay. Next slide, Danielle, please. Um, this I think is probably the one of the most important things that as a worker, as a professional, we need to be able to actively engage families in supporting their LGBTQ plus child. And we need to employ the skills that are necessary to help them to support their child and to be brave enough as a worker to challenge the bias, the myths, and the lies about LGBTQ people. There are so many myths that float around, right? Families will say, you know, well, I can't have this in my family. I'm deeply religious. We can't have this. And why I put up that little graphic is because, you know, I don't understand why people think having a gay child means they failed as a parent. Disowning your child means you failed as a parent. And that, believe me, as somebody who worked in foster care for many, many years, and I ran a group residence for gay, lesbian, bi, and trans kids, the majority of my kids were kids who were thrown out of their own families because at some point they were identified as being gay. And sometimes we were successful in reuniting that child with their family. That was always wonderful. But sometimes we were not. And you know, and that was painful for that child who then said, you know, I did everything I could to get my parents to love me and they wouldn't love me. You know, they couldn't love who I was and they wanted to change me, but changing your orientation is really not possible. And we'll get to that a little bit more. But it's almost like I say to people when they have a hard time understanding it, it's kind of like being left-handed or right-handed, right? When you grow up, you don't choose to be left-handed, you are. Right. I went to Catholic school when I was a kid, and the nuns used to tie the hand of the left-handed kids to the desk because you were not allowed to be left-handed, and they would force them to write with their right hand. And it was like that was a difficult thing for a left-handed kid to do, right? They weren't choosing to be left-handed, they just were. And my own research and my own process about why one is lesbian, gay, bi, or trans is because you are. It's part of who you are. It's not hereditary. It's not learned. It's something about who you have emerged to be. Most kids don't choose to be gay, lesbian, bi, or trans. I think they just are. But helping families to really know what it's like is critical. You know, I myself did not come out until I was about 30 years old. You know, I was married to a woman. You know, I obviously talked to my wife about that and we separated and we ultimately divorced and then ultimately became very good friends. But, you know, I remember having that conversation as an adult with my mother. And if I had to do that when I was 15, I couldn't have done that. You know, but as a 30-year-old, my mother saying, you know, oh, now that you got divorced, I bet you're going to get married again, right, Gary? And I said, Ma, you know, I think you know, and no, I'm not going to get married. And she literally put her fingers in her ears and said, no, 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 I can't. Jesus, Mary and Joseph, please don't tell me what I think you're going to tell me. And I said, I'm going to tell you because this is who I am. But can you imagine? I always kept thinking as a 30-year-old, I was living on my own. I was a professional, I had a master's degree, I was supporting myself. It was hard enough, but imagine to try to do that when you're like 13, 14, or 15, right? And be terrified that your family's going to disown you, be terrified that they might throw you out of the home, be terrified that in many cases, the kids I work with were really brutally, physically and emotionally abused by their families as a result of that being found out or coming out. Coming out was planful, being found out was always like a crisis. And I always say, can a social worker know how to deal with that family in crisis when that family finds out unexpectedly, maybe, that that child that they've loved until 5 minutes ago is gay, lesbian, bi, or trans? How do you help that family learn to continue to love that child and to continue and to deal with some of the issues that happen? Families feel embarrassed. Families feel like a shame about, oh, what people maybe will think that I did something. I remember my mother had three questions for me. Was it, my father had died. Is there anything that your father ever did to you? Because it was safe to ask that question. No, Ma, nothing. Was it anything that the priests in the church ever did to you? Because I worked in the Catholic Youth Organization as a kid. No, Mom, nothing happened to me. And then the last question, which was the real question, was, God forbid, was it anything that I did that made you this way? No, Mom. I just am who I am. It's nothing that you did. But again, as a teenager coming out as a teen, and I have to stop and say, not all teenagers come out, okay, to their families. Many of them have determined that they can't and they don't until much later, okay? And sometimes parents are very supportive, but as social workers, I did not see those people, right? The kids whose parents were like, "Oh, it's okay, honey. I know you're a lesbian. That's all right." I never met them. I met the ones who the parent refused to speak to them, threw all their clothes in a garbage bag, and threw them out of the house. I mean, literally. So I would not all families are going to be like that, but I think the consequence and the fear that young people have is there. And you, as the social worker, are the one who's supposed to be helping them to work through some of that bias and myth about what it means to be gay. I mean, parents will say, "Oh, they're never going to be happy." That's not true. They're never going to have children. That's not true. They're always going to be ostracized by everyone. Not true. So, I think families have fear. I'm a parent. There are things that I wish I could prevent my children from doing at times where I could step in and stop it. And sometimes you can, and sometimes you can't. And this is one of those things where you really, you cannot stop a child from being who they are, right? There's nothing harder than not being able to be yourself. So how do we help a family continue to really be able to be a good parent for that child? And it takes time. The kid has had a long time to think about it, usually. The parent has not. I'll tell you one interesting story. I had a woman who called me one time and she said, "I need to talk to you because my son came out to us last night and I'm deeply troubled by that." And I said, "Okay, tell me why you're so deeply troubled. It sounds like he came out, right?" She said, "Well, because he lied to us for like 6 years." And I said, "Well, what do you mean?" She said, "Well, he's 17 and he came out to us, but he told us he knew he was gay since he was 11. So he's been lying to us for 6 years." And I said, "Hold on a minute." She was a social worker too. It's like, you ever hear of the concept of using denial as a defense mechanism, right? Or kind of not being sure what you can say because you're not sure what the response will be. Your child came out to you when they felt it was safe to come out to you. As a parent, you didn't know and they knew, but they felt like they couldn't come out until they actually did. And that's a hard thing for parents to hear. But we have to be patient as well with parents. And sometimes I've worked with gay kids where they're not so patient with their parent. And I'd say, hold on a minute. You got to also give your mom or your dad or whomever you live with an opportunity to kind of process what this means. They're not prepared for this, right? So how do you help a parent process this in a comfortable and safe way? I mean, my mom immediately started throwing on things, "Don't tell anybody in Ireland that you're gay." I said, "Oh my gosh, that's like, I'm not really thinking about that. You can't tell your brothers." I said, "I already told them." You know, so families have these things, and of course, growing up in an Irish family, the worst thing you can do is tell your family business to people, right? So that's another whole thing, right? Of, don't tell these things that should be kept to yourself to everybody else. But when people are coming out, sometimes, especially young people, they're happy that they can finally be their authentic self. So they're able to kind of start talking about this for maybe the first time. So again, with parents, this is such a critical issue, and we could do a whole training on this as well. But because I think that it's really important that we help parents, what I always say, to continue to love that child that they have, and to not change everything about them because now they have this new information. Okay, Danielle, can you do the next one, please? This is such an important one. As professionals, as advocates, we really need to reject and work towards eliminating all conversion therapy practices. They don't work and they are actually harmful to LGBTQ children and youth. Just think, if you're trying to stop a kid from being who they are, it would be just as harmful to stop a heterosexual child from being who they were, right? And these practices are incredibly harmful to young people. And if you read the research, you will see over and over again, you can change people's behavior, but you cannot change their internal sense of fit. Okay, and that's what being gay is about. It's not just about sexual behavior, it's also about one's internal sense of fit. So I can't emphasize enough how harmful these conversion therapy practices are and how much we need to speak against them and certainly not encourage anyone to use them. And however we can in a legislative and legal way is to help really people to understand that these therapy practices do not work and are extremely harmful to young people. Next slide, Danielle. Um, the other piece is, we're talking about gay, lesbian, bi, and then trans young people. These trans young people are young people who essentially, have a gender assigned at birth, okay, that they no longer feel fits them. Okay. And these are young people who really need what we call gender affirming healthcare I'm sorry to be so vociferous myself about this, and it's happening in my country too, and I am very upset about it and have tried everything we can to possibly work against it. But we really need to work against politicians who are making healthcare decisions and passing legislation that is completely politically motivated and harmful to young people and not in the best interest of trans children, youth, and families. Politicians do what they need to do to appease their constituents, okay? And I understand that there's a whole thing about, the puberty blocker ban and other kinds of things. And they've convinced themselves if they do that, then this will stop. It will not stop. Children who are forbidden from getting puberty blockers, that they are prescribed by a doctor, not a politician, not a social worker, a doctor that can't get them will obtain them illegally and then will be much more harmful effect when they try to do that. It is so wrong that when we hear, and I know there's a whole CAS report and all of this stuff that has come out here in the United Kingdom, and again, we're seeing it in Florida and Texas and all these places. I always say, as a parent, it's like if I knew my child needed to have his tonsils removed, and the government said, "I'm sorry, your child. I know he's having terrible problems with his throat. I know he's having sore throats, and he's every winter it's terrible. But no, I'm sorry, he's not allowed to have his tonsils removed until he's 18." As a government making that decision. I believe this is completely wrong. And as social workers, one of our jobs is to be advocates as well. And to really say when a child's parents are saying, this is what my child needs. These are not kids who are going out and saying, oh, I want hormones and I want to transition. These are usually children whose parents are helping them to transition to the gender in which they really feel fits them best. Okay. And we're not talking about 12-year-olds. We're not talking about kids just, getting this in school. I'm talking about prescribed by doctors, preferably endocrinologists who actually know what they're talking about, and certainly not politicians. And I'm sorry to be as blunt as I am about that, but I just think, and I'll speak from my own country, I think it's horrendous what people are doing. And one of our presidential candidates is spouting nonsensical things that are just not true. I've heard him say over and over again, these kids go to school and one day they're a girl and the next day they're helped by the school to become a boy. That is completely untrue. There's a whole protocol that's done by an organization called WPATH. And if you want to check that out, you should look it up. I think it's WPATH.org. It's a whole protocol for how you work with young people, with mental health care, with testing, with working with families, with something that's called social transition, and then later discussing medical transition. There's a whole protocol. It's not some willy-nilly thing where somebody gives you puberty blockers and then all of a sudden, you've transitioned. And that's how I think it gets categorized. So as workers, we also need to be knowledgeable about these things. And I know, once something becomes a law, what can you do? But it's almost too late to actually, advocate against that. But I think where there's an opportunity to advocate against those kinds of policies, we need to be able to do that. And again, it's an error on the part of people who are passing this legislation to think that that's just going to stop. People go underground, and then they will even be more at harm and more at risk for obtaining illegal puberty blockers through the internet. So, and then the other issue becomes, and if they try to enforce this, who's going to have to enforce this? Sadly, Probably social workers, right? Oh, this family is, this child is getting hormones illegally, and then do you become the person that reports them for something that, maybe you really believe they needed? It's a big mess. It's really a very upsetting kind of situation. It's not the only thing. And then trans kids have lots of issues around pronoun use and around bullying in school and around, the way they dress and, just kind of things that happen to them, on the street, and in their own families. So there's so many other issues. It's not just about puberty blockers, but I think they need gender affirming healthcare in a number of different ways. The other thing that when kids take puberty blockers on the streets, they share needles. So then their risk of being HIV positive is increased as well. So there's all other complications that I think we need to really think about and consider. Okay, the next one, Danielle, please. Um, hate crime legislation through advocacy and legislation wherever we can do that. I mean, I heard a story yesterday about a young trans person who, is transitioning, and she went someplace in Belfast here, and somebody intentionally, when they went by in a car, splashed her with water. And then she went to an event later and she was harassed verbally by people at the event that she went to. I mean, these are the kinds of things that young people who are gay, lesbian, bi, or trans experience all the time. I mean, when I ran my group home, I used to go on the subways in New York with kids, and I would see what people would say to them, and I would think to myself, my goodness, as a young person, hearing adults say really negative things to you, or verbally or sometimes physically trying to attack you, just because of who you are. Is something that we all need to be really concerned about. And there's all kinds of hate crime legislation around other forms of diversity, right? And I think we really need to think about how do we incorporate hate crimes against LGBTQ plus people as well, not just about race or culture or ethnicity or immigration status. I mean, we're seeing all that too, right? It's not like we've all fixed it. And again, I'm not in any way pointing the finger at you all. We have the same problems in the US around these issues. We have some hate crimes legislation in some states, which is good. They've actually attended to it, and in other states they have not. So it's a work in progress. And again, social workers, I think, in their advocacy role, need to be at the forefront of speaking about these issues and really working towards promoting legislation that would protect people from hate crimes, especially young people. It's really detrimental for a young person to hear adults or other kids. When I did my work, I did my doctoral dissertation on the experience of gay and lesbian adolescents in child welfare systems, and I would always say, what have you experienced? 100% of the kids experience verbal abuse, and many of them experience physical abuse. And I would always say, oh, from your other peers, right? And they would say, sometimes from peers, but it was worse when it came from adults and from staff members. And I said, the verbal abuse also came from staff members. Oh, yeah. They misgendered me, or they would literally say, you don't need to be talking to people about this stuff. If you didn't talk about this stuff, nobody would bother you. You should keep that to yourself. That's why the closet door is there, right? Because, a lot of times people want to push kids right back in that closet so we don't have to talk about this, we don't have to deal with this. But the reality is that people need to be able to be who they are. So you need young people to be able to feel safe and comfortable. And a lot of times young people don't feel safe. But forget young people. Adults don't sometimes feel safe either. I mean, I'm an openly gay person and I'm pretty comfortable about who I am, but there are moments when, you know, I'll tell you a story. My husband and I in New York were walking down the street we live on, and we were holding hands. And these men on the corner, who incidentally sell drugs, were saying really horrible things about us as we walked by. Like, oh my God, can you believe this in our neighborhood? Look at this crap. This is disgusting. This is horrible. I remember thinking, my God, you're selling drugs and you're criticizing me for holding hands with somebody I love and I'm married to. But like that kind of stuff, again, as an adult, I can ignore it. I can keep walking. I don't have to deal with it per se. But as a young person, and sometimes young people get into it with people, which makes it even more possible that there's going to be violence, right? They get to a point where they can't take it anymore and they start responding. So I think, a lot of us are conscious of creating, is it a safe environment for us to come out in or not? Is it safe to be able to be myself? And if you're a trans young person, a lot of times there's visual stuff, right? You've transitioned physically, so therefore you might look different. If you're a gay or lesbian or bi person, possibly you could hide if you choose to. right? So it's not always so obvious. If you're a person of color and you're lesbian, gay, or bi, or trans, then you have another level of issues that could come towards you in a very negative way. So again, complicated things that I'm not saying we need to solve every issue, but we need to be able to advocate against, hate crimes. We need to be able to support legislation that promotes protecting people from hate and work towards that goal. But it's definitely an issue. Safety is a very, very big issue for LGBTQ people, all the time, almost every day. And I think that, if you're not an LGBTQ person, you might not have ever felt that. So if you are an LGBTQ, if you're a person of color, you felt it for sure. But if you're a woman, a lot of times you feel it in a different way. But I think, sometimes people don't even know what that feels like because they've never had that experience. But believe me, it's not fun, and it wears your self-esteem out. You know, you just think sometimes, my gosh, I remember walking down the street, and people would say to me and my husband, like, which one of you is the woman? And I would think, really? Like, why do you even need to confront me like that? I'm just going about my business, shopping or whatever I'm doing. I'm not challenging you about who you are. But again, I'm giving you the example because as an adult, it's offensive and it's hurtful. As a young person, it's deeply hurtful and offensive because I think they're still developing who they are. They're still coming to terms with who they are. And so sometimes it even hurts more, or they might respond in an inappropriate way. Okay, next slide, Danielle, please. Um, you know, if you're a young person who's gay, lesbian, bi, or trans, you are trained about sexuality completely from a heterosexual perspective, right? When you go to school, they're talking about dating between a boy and a girl. They're talking about marriage between a man and a woman. It's a completely heteronormative view of dating, relationships, and sexuality education. It's almost never included with lesbian or gay folks. And I'm not talking about intensively talking about what do gay people do sexually, what do lesbians do sexually. I'm talking about relationships, right? Is it possible for people, of the same gender to date? Is it possible for kids who are not really sure to say, well, I like boys and I like girls, and is that all right? And how do we include that in an education way? And again, there's so many challenges that people have about these things. I teach a class on child welfare practice, so I'm always trying to incorporate normative ways of looking at like gay parents, okay, or looking at kids who are dating and what that means for a lesbian kid who's dating. Just so I get students to start thinking about that. I think in some ways we're not talking about completely writing a curriculum today, but like how do we begin to look at that? And if some of you train foster parents or are working with foster parents, how do we help those foster parents to realize that some of the kids they have in their care might be lesbian, gay, bi, or trans, right? We don't particularly need to do a specific training on LGBTQ issues. But I think when we're doing training and we use vignettes to illustrate experiences, can we use vignettes where we're using vignettes that talk about a gay person, a lesbian person, a bi person, a trans person, or a questioning person? A young person who's not sure. Can we at least introduce some of those concepts so we can start the dialogue and start thinking about it? And there's lots of things that we could do educationally with curriculum and whatnot. And again, in school systems, this becomes a really hot potato, a really hot issue. Parents don't want their children to be taught by people who are talking about things that they don't agree with. It's a challenge, I know, but I think also there are ways to begin to talk about these concepts. I know even in higher education. I mean, and my students in my MSW classes and BSW classes will say, our faculty never really talk about these issues. And it's like, well, you'll be working with clients who are lesbian, gay, bi, and trans. Nobody's talking about this? Not really. So I think, and we're beginning to be smarter about diversity around the world, I think. But we're not getting to the point where we're including LGBTQ issues in that diversity uh, panel panorama. We're not oh, partially because it still creates discomfort in people. And I think a lot of sometimes we're uncomfortable about it, and therefore we don't know how to do it. I often say that, if I talk about this with my colleagues at a faculty meeting, then I start getting a million invitations to come and speak in their class about gay, lesbian, bi, and trans identity, which I'm happy to do, but that's not my job. I mean, I already have a job. Their job is to like do their homework and to incorporate that content into the curriculum, but a lot of them aren't comfortable with that, right? And I think similarly, we see it with respect to race. I'll see, white faculty who are not as comfortable talking about, being a person of color and what that means. And again, some of it's just doing your own homework, but some of it is also kind of taking the risk and kind of introducing content where the idea is about helping social workers to be more competent in practicing with diverse and sometimes vulnerable populations. Okay, the next one, Danielle. Okay, we're switching gears here and talking about the second level here of what do agencies and policymakers need to be competent in practicing with LGBTQ children, youth, and families. The first level is how do you create an LGBTQ affirming environment in an organization, in an agency, in a school? Some of it is using appropriate language. Some of it is incorporating the actual words sexual orientation, gender identity, LGBTQ into your website, into training that you do, into policy statements that you make. Just making it clear that your agency is an agency that welcomes all people, right? That you're not using any kinds of lens to be biased against people, that you're an affirming agency that really can address these issues. But to do that, you need to train your staff. You need to be able to have staff that really are comfortable enough and competent enough to deal with this. And partially it's about messaging, putting out the message that your organization is an organization that can deal with these issues. I worked in a mainstream organization. It was called Green Chimneys. And we created this entire branch that was all about LGBTQ young people. And I remember some people in our agency saying, well, we don't want to be known as a gay agency. And I said, well, why would that be a problem? I mean, you're not a gay agency. You're an agency for children, youth, and families. And one branch of what you do work in is working with LGBTQ young people. How does that make you a gay agency? But again, this is people, what organizations are thinking. Maybe our funders won't like that. Maybe our board of directors won't like that. You know, and I always said, okay, well, what do your clients need? Right? I mean, we're supposed to be responsive to the needs of clients, right? Do we have clients that need our services? I'm sure that we do, right? In mental health and in hospitals, in schools, in child welfare agencies. So how do you make your organization affirming? And it doesn't cost you any money, because that's the first thing everybody always says, well, we don't have the funds to do that. Well, really, changing your website takes 3 seconds, right? Incorporating a couple of words about, we welcome everyone, right? We welcome all people, or kind of putting on some symbols and signs. Actually, I have it, and I'm going to give this to young people when I meet with them on Friday. But we developed this little, oh, here it is, safe zone sticker. Many years ago, it's just a little sticker that says, the safe zone is a symbol to message gay, lesbian, bisexual, and trans youth that a person displaying this is someone who is understanding, supportive, and trustworthy if you want to talk to them or if you need help. I mean, it's a simple, simple thing. It doesn't cost anything. You can go online and print this out, right? And you can put it on your bulletin board or on your door of your office or on your agenda. I can't tell you how powerful that is. I can't tell you how I used to give these out at trainings I did, and the next day I would get like 25 phone calls saying, I put this on my office door, and 4 kids that I never thought were gay or lesbian came to me and said, I saw that sticker on your door. Can I come and talk to you? I think it's also helpful for kids who are not gay to say, hey, miss, why do you have that sticker on your door? Are you a lesbian? Well, no, and that wouldn't be relevant to what we're talking about. But, the issue is that I want to make sure that young people are comfortable to talk to me about things. So that's why I put it up there. So it starts a conversation. It's a bridge. And that's what I mean by a gay or lesbian, bi or trans affirming agency, is how do we make that bridge that people feel comfortable and, again, safe to talk about these issues? Okay, next one, Danielle. Um, Helping organizations develop written policies, appropriate and supportive supervisory practices, and coaching about sexual orientation and gender identity expression. That's our job, right? Workers will tell you, I can't do this because there are no policies in my agency that support me in doing this. Well, again, it's not that hard to say. We welcome everyone. We work with all young people, regardless of sexual orientation, religion, gender, race, all of the things, right? Spelling them out. And we have supportive supervisors because we've trained supervisors to supervise to the policy. And we have social workers who are competent because we've done training and we have coaching about those issues. I did a major training project in the state of Louisiana, which is a very conservative state. And I did a lot of coaching. Like they'd say, I don't know how to deal with this transgender young person. I'd say, you know what? Let's get this kid on the phone. Let's get them on FaceTime. And I'll model for you how you can do it. And then you need to practice that too. And it was nothing, Hi, how are you? What's your name? Oh, well, my legal name is John Jones. Oh, is there another name you like to be called? Well, yeah, I actually like to be called Jane. Okay, Jane. So how you doing? Are you safe in your foster home? I mean, it was just a matter of having a conversation and talking comfortably about some of the issues. And once the workers had that kind of coaching, then they could do it themselves, right? And they weren't coming to you all the time to do it. And once you've done the training, then the supervisors felt like, okay, I can talk to my staff about this. Because you sometimes have supervisors say, I don't know anything about this. They weren't talking to me in social work school about this when I went to school. And the reality is that as a supervisor, everybody expects you know everything, which we all know is ridiculous. But the young workers looking to you to guide them. And if you don't have policies that support this in your organization, then the supervisor, the worker doesn't have a leg to stand on, right? Because if you have somebody on your board or somebody executive director or CEO that says, hey, what are you doing here? Like we don't support that. Well, then that could be really problematic. So I think you need to think about how would you develop these policies that support this work. Okay, next one, Danielle. I think also you have to have consequences for professionals who refuse to provide gender LGBT affirming care for young people. And actually, I saw on your website, on the Northern Ireland Social Care Council website, how if somebody was doing something that was considered to be against the code of conduct, that you could ask that to be investigated. So I mean, I not that I'm into investigating people for doing things wrong, because I think there are other ways of dealing with that. But I mean, there are some people that just say, I don't care what you do, I don't care what kind of training you do, I'm against this stuff and I'm not talking about it. Well, if the policy of your agency is that we support everybody and that we do talk about these issues, and then you have somebody who refuses to talk about these issues, I think there should be consequences for people who don't follow through on supporting the issues as per your policy. That's why policies are so important. If you don't have a policy, then you can't really do that. And I always say, in the absence of policy, people make up their own policy. And a lot of times it reverts to, well, my mother said, it's like, again, was your mother a professional? No, not really. She was a good mother, but she wasn't a professional. So I think we need to also have consequences for people who just adamantly refuse. I worked in an agency that was primarily LGBTQ oriented, but I remember in the beginning when we were making some changes, I had staff who said, well, I can't do this. And I'd say, well, then you better go look for another job, because this is what we're doing, and we need people to be on board. And if you feel like for whatever reason that you can't do this, then perhaps it's time for you to go find employment elsewhere. And we had consequences for staff who, for instance, would misgender kids. When kids would say, "I really would like you to use this pronoun he, she, or she, or excuse me, he, him, she, her," and the staff member would say, "I'm not doing that because you were born a boy, you have a penis, and I'm calling you by your boy name." I had staff say that, and I would say that that is not appropriate. We have a policy here, and you need to adhere to the policy, not your own policy, the agency's policy. So again, not that you want that to be the issue and the way that you don't want to punish workers, but I think people get held accountable all the time for things. So why not hold them accountable for something that relates as well to gender or sexual orientation? Okay, next one, Danielle. Partner with LGBTQ organizations that assist you with resources, service, and training. Here's just two that are right here in Northern Ireland: Rainbow Project, Cara Friend. And in other parts of the UK and Ireland, there are lots of other go online. All we have to do is put services that support LGBTQ youth in I don't know if any of you are listening to this who are from Armagh. There's a little program in Silver Bridge, which is this tiny little village in Ireland that my grandmother was born in. And they invited me to come there a couple of years ago to talk to their LGBTQ youth group. It's like, oh my gosh, in the middle of this little village, they have this supportive, and it's a coffee house. It's no big thing, but it's beautifully run by young people work there. And I thought, my gosh, if they could do that in Silverbridge, why can't other people do that in other parts of the country, right? So, I don't think you have to have an LGBTQ organization to do that, but we're lucky enough to have some of them. So let's, draw on their expertise for training and for maybe referral services and for advice sometimes. They may have lots more knowledge than you do about some of these issues, and they're available. And I believe, in my meetings with them, that they've been incredibly helpful and are interested in helping people. So partnering with them is important. And I think mainstream organizations need to partner with LGBTQ organizations to support one another, because sometimes the LGBTQ organization can't even get a meeting with, the minister, but a mainstream agency can. So can you help the LGBTQ organization get a meeting with the minister? Can you support them? Can you invite them to come to your meeting? I mean, some of these things become highly political, and sometimes there's consequences for that. And, I don't want you to get in trouble, but I think there's times when we can do things that support one another, and we need to think about how to do that. And again, in the service of the people we work with, not about ourselves. Will this provide more competent and effective services for LGBTQ young people? If the answer is yes, it'll help them. Then we need to do what we need to do to partner together with people. Okay, next one, Danielle, please. You know, faith communities in Northern Ireland, as I well know, the first time I ever came to Belfast was in 1970. So, boy, I saw things that, were very different then than they are now. But communities of faith here are very important. And, we have this mentality that many communities of faith are against LGBTQ people. Not all of them. And I think it's incumbent upon us to find the ones that are supportive of LGBTQ young people. Because also, young people grow up in families where their families go to Protestant church or they go to Catholic church, and they're looking for either the messages that are affirming or the messages that say you're sinful and you're evil and you're going to hell. Believe me, I've been sent to hell many times myself. But the issue is, you want young people to not view communities of faith as these very hostile places. So where we can we identify places? And I'm sure they're out there. I don't know enough about individual places to guide you there, but I'm positive that there are churches that are much more affirming than others. So how do you, maybe that minister can talk to somebody else about their child, and this is helpful with parents too, because a lot of parents will say, I'm not upset about the fact that my kid is gay per se. I'm just worried about their mortal soul, right? I'm worried about what this means for them. Having somebody who is a person of faith, who is, trained in that, can really help them understand things in different ways. I always like to have had, and I had people I could draw on and say, Father so-and-so, could you come and, meet with me and talk with this family a little bit? I'm not asking you to change their mind. Just share with them a little bit about kind of the philosophy of, God is love. And if we say that we love God, but we don't, if we hate our brothers, then what are we doing? Right. So, this idea of compassion for one another, it can be really helpful. And families really need that too, because I think this is one of the biggest stumbling blocks that not just here in Northern Ireland, but in other parts of the country, in my country as well. In the South, it's very Bible Belt oriented. So, lots of people will say, I did a lot of work in Mississippi and Louisiana. And I did a lot of training there many years ago. I remember this one woman coming to me at the end of my training and saying, Mr. Gary, they always called me Mr. Gary. Mr. Gary, I'm a woman of faith, and I love my church, and I love God, and I love the Bible. And when I heard you going to do this workshop, I thought, oh, I can't go to that. I want to hear that mess. So, but sitting here and hearing you and listening a little bit in ways that I hadn't before had made me really feel better about this. I'm not going to completely change my mind, but it allowed me to open the door. And I thought, that's all I would always say. That's all I want. And in these cases, it was not like a professional training per se. They were for, anybody who wants to come and foster parents. But, I wanted them to at least be able to hear some things that help them think differently, that not all gay people are, sexual deviants or sinful or evil or, or out at clubs dancing all the time. Some of us are dancing a lot, but, the reality is that we're not all out there. As a gay parent, I raised 4 children, but they were all adopted. And people would say to me like, oh, in the beginning, do your kids ever go out with you to the club? I'm like, are you kidding? Who would bring a child to a club? Right? You're home doing homework with them. You're doing laundry. You're trying to go shopping. You're cooking. You're doing a school project that they tell you about 5 minutes before it's due. Being gay has nothing to do with being a parent in that regard. So I think sometimes helping to bash those myths are really important. And I think, and sometimes people in these communities of faith really can help us do that too. I never see communities of faith as being a negative. I think it's a positive, but it's how we use them. The next one that Danielle's gone through already, and thank you, is how can we hold political leaders accountable for making responsible decisions that affect the lives of LGBTQ children, youth, and families, rather than making these decisions that are completely politically expedient for them? I'm appalled by what's happening in my own country about what politicians are doing. And in every opportunity I have, I say, this has nothing to do with transgender kids, with their parents, or with healthcare. This is completely political. And I think that has happened around the world. And I think we need to be able to say, you know what? This is not about trans kids. This is not about healthcare. This is not about parents. This is not, and I heard from somebody the other day saying, well, even parents who are supportive of their trans kids are being told sometimes you're encouraging this behavior and therefore that's abusive. That's ridiculous. That kind of attitude of a parent who is supporting their child, again, in being who they are. And these are not kids who just one day decide they woke up and now I'm transgender. That does not happen. Or now I'm gay or lesbian, whatever. These are kids who've done a lot of thinking about it. There are kids who have been probably very quiet about it. And if they're brave enough or feel confident enough with their families to share this with them, and then their families support them, that's a miracle. I mean, I can't tell you how many poor kids. It would break your heart that I worked with in my program in my 20 years of running that agency. That they would have done anything to have their family love them, and many of them could not. And a lot of times it was around bias and prejudice and discrimination and silly nonsense. Some of which had to do with culture at times, some of which had to do with religion at times. But politicians really have gone whole hog in terms of kind of taking on this trans issue. And in the United States, it's also issues around abortion and and immigration. It's all these pockets of people that they've identified as kind of safe to go after. So I think that there are times we need to call them out on it and saying, this is enough. We do elect them, I think, right? So, maybe if they think they're not going to get reelected, they will listen in a very different way. And politicians are there to serve the people they represent. It's not they're there to, make policies and laws that are gonna kind of make them look better in the media eye. A lot of it's about media too. A lot of them get a lot of media attention when they do this. They're on the news and they're talking about this and they're going to fight this and they're going to show people that this is wrong. I don't have any time for that. And I think as workers, we need to be able to advocate against that kind of attitude. Next one, Danielle, please. Can we be active advocates on behalf of LGBTQ young people and families when we see bias, discrimination, or outright hatred? That we need to be able to speak up and to say, this is wrong, right? This is wrong that this happened to this young people. This is wrong. And not to think always that it's other kids and boys will be boys. A lot of times it's adults, not kids, that are doing the same thing, or just perpetrating misinformation, like the guy who's running for president in the United States, just perpetrating over and over again lies and misinformation, that is just not accurate. So how do we do, and especially when it's about outright bias and discrimination? And I've seen this. I used to bring kids to school and be met at the door by the principal of the school saying, no, 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 we're not taking this transgender kid in this school. No way. When the kid lived in their school district and had a right by law to go to that school. So, it was not even that there wasn't a law protecting them. It was people who were stopping them from getting the services that they needed. So I think we need to be able to advocate against that in a strong way and to say, no, I'm sorry, this child needs an education. No, I'm sorry, this child needs health care. This child needs mental health services. And our job is to help access services that are appropriate for them. And your organization apparently is an organization that is appropriate for this kind of service, and that's why I'm bringing them here. So I would expect that how to address their issues without bias or discrimination. Okay, next one, Danielle, please. This is the last track, and then we're gonna stop right after this. These are personal stuff, right? Don't accept anti-LGBTQ behavior as much as we can. The second one, and this is from my own family too, don't laugh at LGBTQ jokes, even when your own family makes those jokes. I have brothers who are New York City police officers, and let me tell you, they are not open-minded and they are not social workers and at all. And they say horrible things at times about people. So, a lot of times you're sitting at the dinner table and you're like, I don't think that's funny. And they're like, oh yeah, you're such a snow. They call in the US they call it snowflakes. Oh, you're such a snowflake. And it's like, yeah, okay, I'm a snowflake, but I don't think that's funny. And I think that we need to be able to speak up. I mean, you don't want to ruin the dinner, but at the same time, it's painful to sit there and listen to jokes that people make about people that you care about. The third one is, what's the big red button on top of your head about your issues about LGBTQ people, right? We all got that, right? It's a little something that's right under the surface. Like, we're okay about LGBTQ youth, but I don't know. Do you think that lesbian and gay people should adopt kids? I'm not sure about that, right? I'm joking. I think they should be able to, but it's this. What's the big red button on top of your head that can get pushed about it? The point at which you say, well, I'm okay up to that point. I think we need to personally explore that for ourselves. I think it also is important that you realize it does not matter if you don't get it. Gay, lesbian, bi, and trans people are going to be there no matter whether you get it or not. Okay. And it'd be better if you get it. It'd be better if you understand it. But whether you get it or not, it doesn't really matter. They're still going to be there, and they're still going to live their lives, and they're still going to come to your organization or to you as a social worker for services. And either you're going to be competent or you're not going to be competent. The last one on this slide is, and I think this is the most important one of all. How can you help parents continue to love that LGBTQ plus child as they are? How do you say to that mom, I know your kid just came out to you, but what can I do to help you to continue to be the wonderful mom that you've been and or dad, and to continue to love your child just as they are, even if you don't understand everything about them right now? How do I help you continue to love them? Because a lot of times I saw out of the house. They were thrown out. Moms were better than dads. I'm sorry, dads. Women were much more comfortable with these issues. Not that there wasn't abuse there sometimes too, but I saw people physically attack their own children because the child disclosed or they found out that the child was gay. That's like the worst kind of parenting you could possibly do, right? And certainly nothing Christian about that, right? Throwing your own child out of your house, now making them homeless, right? I heard yesterday somebody who was telling us about the ones who, oh, the parents are encouraging the kid to be gay, and then they take the kid away from the parents and they put them in a foster home or a group home that know nothing about gay people. Oh, that's really wonderful. So like then the kid continues to struggle about being themselves because now they're continuing to live in a family that really doesn't understand them. Okay, next one, and then that's the last of my slides per se. Be brave in your practice to support LGBTQ young people. You need to be brave to do this work. Not everybody's cut out for it. And I don't believe you can opt out of it and say, well, I'm not doing it. I believe that we all need to learn how to do it. But it does take a level of bravery. You got to be prepared for backlash from your colleague in your community. You slap up one of these safe zone stickers and either somebody's going to rip it off or say, I didn't know you were a lesbian. Oh, wow, you're a lesbian? I always say, are we alcoholics when we refer people to Alcoholics Anonymous? No, you're referring somebody to a service, right? So, but I think that the backlash can come, right? You got to be prepared for that. Remember what we're called to do as social work professionals, and this is from your own website, working together to make a difference, right? That's what we're supposed to be doing, right? When people get so upset about this topic and they think, I can't do this, and I don't know why we have to do this. I think because we're working together to make a difference. And I think that your competent action or inaction really does make a difference in the life of an LGBTQ young person. You know what? If you're competent and you've made a difference, that will affect that child for the rest of their life. Just like if you are incompetent and have not acted, that will affect that child for the rest of their life. So, important things to think about. Just next couple of slides, and then we're going to pause for some questions. These are some references. This is a book I wrote a couple years ago, super basic. That's where it is. You can get it on Amazon. Next one. This is another book I wrote about social work practice with LGBTQ, but I think I need to rewrite it because it was done in 2020, 2011, so it's getting old, but very much for social workers. Next one. These are about transgender kids. Strategies for child welfare professionals working with transgender and gender expansive youth. I wrote this one during COVID, and it was fairly recent. And it's all about trans kids. And again, there's a lot of issues about trans kids that are slightly different. And then the last one is social work practice with transgender and gender expansive youth. And this is a book that I did with my colleague, Jima Shelton, who is a trans person who works with me in the college at Hunter College. And everybody that wrote for this book is a transgender person except for me. So it's a good book. It's really thoughtful. And then the last thing, Danielle. Oh, the last thing here is my email and my phone number if you want to call me. And I always say to people, you know what? If I said something and you want to talk more about it, or if I said something and I made a reference to something you want to know, oh, where would I get that? Feel free to email me. I'm very good about getting back to people. And that safe zone sticker is what I kind of held up here before. It's just, one of those symbols that kind of make for a gay, lesbian, bi, and trans affirming environment. And then the last slide. I threw up there at the last minute, but we're not going anywhere. So whether or not we get this, whether or not we become competent, there's always going to be LGBTQ people, and there's always going to be people who are in need of our services. And either we can be competent practitioners or we can be incompetent practitioners. So I would urge you to move towards being as competent as you possibly can. And there's so many resources that are out there online and everything now. There's, in the old days, it was like, oh, I don't know where to go. Now you just plug in gay, lesbian youth on your computer and you'll come up with 100,000 resources. So feel free. But I think the issue is, this is not a population that's going to shrink. It's a population that always has been. And whether they're out or not is another story. If you make a comfortable, safe environment, you'll find that people do come out and that they do talk to you about these issues. And then hopefully you can help them address some of the issues that maybe they're challenged by. So we'll pause here. And I see there's a couple chats, questions, I hope. And I'm happy to answer them. If you put your question or your comment into the chat, I think Danielle or Allison's going to check them out. And it's almost 10 after 1, so we got about 20 minutes. And also the other thing I'll tell you is, if you're working in an agency and you think, gosh, I'd really like to do training, I'm coming back to Ireland in March. So I'm happy to come to your agency if that's you think is helpful. And it's a 6-hour plane ride from New York. So it's not something that takes a lot of time. And nobody's paying for me to be here. I come for free. So, don't worry about that. I'm happy to come and provide my services if that's something that you think might be useful, if we can plan it out. I probably shouldn't have said that, right? Because maybe some of you have a lot of money and you want to pay me, which I'd be happy to accept, but I don't think so. Social services never has money, right? I'd rather you spend your money on your clients.
Gary, I'm just looking at the chat. So there's a couple
Sure.
of thank you messages.
Well, thank
Fergal
you.
McMahon has said it might be useful to signpost some relevant research to facilitate or allow informed practice, advocacy, and debate. But I think you've addressed that, Gary, as you've gone through
Yeah.
your presentation in relation to resources, but also
Yeah.
highlighting the fact that we all are social workers and need to do the background work in terms of being able to Google Northern Ireland LGBTQ plus support. So hopefully that's
Right.
answered Fergal's
Yes.
question in that
Yeah. And there's a
respect.
lot of research that's out there now. If you go into something called googlescholar.com and you look for something, all the most recent research pops right up. So, and if it's practice-based research, I think it can be very helpful to you. And it's also helpful background-wise when people may challenge you to talk about the research that way. So feel free to check out googlescholar.com.
Do we have any other questions? Does anybody want to either pop it in the chat or come off mute for Gary? Or me from a Northern Ireland perspective? if there's anything more specific that you wanted to know.
All camera shy, Danielle.
I know.
That was very interesting, and it was great to hear your experiences, Gary. Thank you for sharing them.
Happy to have done that. And if people want to send me an email afterwards and ask me something, I'm very happy to talk to you about that as well. And there's lots of information online. I mean, so it's overwhelming how much information is online nowadays. So, just typing in LGBTQ youth or LGBTQ social work or LGBTQ support, there's tons of stuff. And again, I don't mean in any way to, diminish the good work that people are doing. I think we could always do better work, right? I mean, one of the reasons you do seminars is to introduce you to the thoughts and hopefully get you thinking. And again, this work is not particularly easy. I don't think it's particularly challenging either. I always kind of de-homosexualize it and say, how would we deal with this if it had nothing to do with a kid who was gay? And then kind of address it that way, because a lot of times people think you need some special technique or special thing and you don't. If you know how to work with teenagers, you know how to work with these kids, right? If they talk to you about something that you don't understand and you say, can you clarify that for me a little bit? I'm not so sure I understand what you're saying. They're more than happy to tell you, right? But they're watching you too, to see if you're somebody who is safe enough to talk to. That's the issue. And if they don't think you're safe, they won't talk to you. They'll talk to somebody else. When I interviewed kids and said, who's the people that you talk to? When I ran my group residence, who's the people you talk to the most in residential care? You know who they talk to? The cook and the maintenance worker. Never the social worker, never the director. It's always like, people who we think of support staff, right? The cook who was there cooking for them, the social worker, and the third person was the nighttime workers, because it was quiet at night, right? Wasn't a lot going on. So they would talk to people that they felt, and I would always say, I remember this one kid saying, I talked to Miss Green. I said, oh, is Miss Green a lesbian? Nah, Miss Green's like 70 years old. But I talked to her because at nighttime we have a cup of tea together and we talk, and she doesn't know anything really about these topics, but she always listens to me. And again, that's what the whole thing is about, right? Is listening to young people and kind of maybe directing them at times, but also really just listening to what they say, letting them tell you their story, letting them tell you what they've experienced. And maybe then I would always say to the cook and the maintenance worker, if you don't know what to say, let me know so we can help you out here. But we don't have to interfere. If you already have a good relationship with that young person, it's not up to us to interfere with that. We want you to keep doing that. But it always surprised me that they would say that. The least educated staff in some ways, not the MSWs, were the people that they went to, because I don't know, I guess because they felt comfortable doing that. Anybody else before
Any
we conclude?
questions? Thank you.
No, everybody's just thanking Gary for sharing his
Oh,
experience and hopefully some really interesting information to take back to people's agencies.
well,
There's
thank
just
you
a
all.
wee question there, Danielle. Did you
Oh,
see it from Noah?
oh, so there is. So how would you help support a trans individual who is awaiting gender affirming healthcare with our long NHS waiting lists?
Oh
The last time I
gosh, that's
checked,
a
it was
really big
78
one.
years long. So yeah, just a bit of context there, Gary.
I, I,
There are
yeah,
1,000 people on the waiting list and have been for 7 years for the Gender Identity Clinic in Northern Ireland. So it is a very hefty and long
yeah, yeah.
waiting list. So how would you
Well,
support
I
that
mean,
person?
I think basically what it is supporting the frustration and waiting, right? And there's ways of social transition, right? So like, talking to them about how are you managing, pronoun use, how are you managing the way you dress, how are you managing the way you might deal with issues in the community or in school or in your family. I mean, there's a lot to still work on, because there's a social transition and there's a medical transition, right? And I'm assuming that the NHS is the medical transition piece, right?
Mm.
So, the social transition piece is large enough, although I don't want to in any way underestimate how painful and challenging it is for a young person to have to wait that long. When you know you need to do something and you've had years long waiting, it's very frustrating and upsetting. So I think it's really just supporting them in managing the frustration and supporting them in managing some of the other social transition pieces that still might be a challenge for them. And how do you deal with the wait? You know, how do you manage, you know, the anxiety and the stress of waiting, you know, and support them in that way. I think that's all we can do. They're not going to hop on a plane and go someplace else, right? They're, you know, teenagers or young people don't have those kind of resources. So, you know, the only alternative is that they wait. The thing I want to also say is, I think what happens when you have to wait though is that, you know, the mental health challenges become greater. You know, is that weight makes that young person really upset, really frustrated, and then sadly can lead to some self-harm stuff, right? And then that becomes so much more tragic, right? It's like, you know, they know they want to do this transition, they're on the waiting list, but the waiting is so long that it really has helped, it has made them, you know, more ill, you know, in terms of emotionally, and also sometimes that can lead to self-harm because, you know, teenagers want it right away, right? I mean, I worked with them for years, and it was like if you told them, you know, I'll do it to you on Friday, it was like, oh no, I need it today. So, you know, waiting for years is like, forget it. So I'm always really concerned about the mental health challenges that come with that, and that's where the support can come in, and you know, and also the possibility of self-harm or self-anesthetization by using drugs and alcohol or obtaining things illegally, right? I mean, I've worked with kids where they actually, girls who were, you know, wanting to have top surgery and they would try to cut their own breasts off. It's like, oh God, that's like the worst thing you want. Or they bound themselves so tightly that they then would have consequences medically around those issues, you know, because they were waiting for so long. So there's all of these, you know, physical health and mental health consequences in waiting that you need to support and help them through.
Thanks,
And maybe
Gary.
give them stuff to read too, you know, or give them stuff to, or you know, these kids are way more savvy than we are about connecting with other people online. I mean, that helps. You know, when I was writing one of these books, I started watching all these YouTube videos about transgender kids who had transitioned. It was incredible. I mean, I thought I knew a lot. I knew some, but I mean, hearing their stories made me realize, wow, that kid was so brave. I mean, that kid had to wait a long time, or that kid had a lot of consequences, you know, around transitioning. But it was really heartening for me as a professional to listen to those stories. So if I was a kid who was, you know, moving towards transition myself, that might be helpful. Or just chats that they have within the trans community for young people might be really, really helpful for young people and kind of assuaging some of that anxiety they have about waiting.
And I think even Gary linking in with some of the LGBT sector organisations, so potentially
Oh yeah.
Transgender NI for support and or
Yep.
the Rainbow Project might be helpful for the
Yep.
person that you're talking about, Noah.
Absolutely. Yeah, in a more real way with kind of, you know, locally working on those things
Mm.
or accessing those resources.
Okay. Any more questions? There's none in the chat. So maybe it's just to say thank you very much, Gary, and thank you very much, Danielle, for
My
taking
pleasure.
time to join us today. As you can see from the chat, people have found it very informative, and thank you for coming along and sharing your experiences.